Hi, everyone. This is Natalie from Barnum. We're doing today an educational session on Medicare. So we're going to talk about the different parts of Medicare, who's eligible, when you should be enrolling, when you should be doing certain things, what's covered, what's not covered, and also what to consider in selecting a Medicare plan. So back to the basics, what is Medicare? Medicare is a federal program designed to provide health insurance for those over age 65 who have worked and paid into Social Security and paid into Medicare. It's also available to individuals under age 65 if they're on Social Security disability and people at any age if they have end-stage renal disease. They must have worked and paid into Medicare for at least 10 years or the equivalent of 40 quarters based on their work history or their spouse's work history. The government gives you Medicare Part A and Medicare Part B. That's all the government gives you. Everything else is from private insurance companies. And we're going to talk into each section. Once you have Medicare Part A and Medicare Part B from the government, then you have two options. You can enroll in a Medicare supplement plan with a standalone prescription drug plan, or you can enroll in what they call a Medicare Advantage plan or a Part C plan. Back to what the government gives us. The government gives us Medicare Part A. Medicare Part A is for hospital services. There's typically no premium if you've paid into Medicare for those 10 years. And with straight Medicare without any secondary insurance, you would have a deductible of $1,676 for each hospital admission within a benefit period. A benefit period is 60 days. If you're there longer than 60 days, it gets pretty expensive. There's a daily fee. So remember, there's no cost for this because you've paid into it all these years. If you did not have enough credits to pay into it, you could pay, your cost will be anywhere from $0 to $515 per month to have access to Medicare Part A services. Medicare Part B, that's really for doctor services. This one does have a premium. The standard premium is $185 per person. And with straight Medicare Part B without any secondary insurance, you have a deductible, the Part B deductible. This year it's $257. Then you're responsible for 20% copay of all services. And there's no cap to your out-of-pocket exposure. So if you think about it, $257 deductible, not a large number. That 20% can get very, very expensive. So 20% of a doctor visit, probably not expensive, but you'd also be responsible for 20% of surgery, 20% of chemotherapy. Those things can add up. And because there's no out-of-pocket limit, it could cost someone quite a bit of money by not having any type of secondary insurance. I mentioned the standard Part B premium is $185. If you're considered a high income earner, you file your taxes jointly, you file your taxes single. If you're above the standard here, you're going to pay more for your Part B premium. So I get a lot of questions on this, so let me give you a couple of examples. My husband and I are modified adjusted gross income from 2 years prior. You have to look, they do look 2 years prior. So in 2023, our modified adjusted gross was $300,000. So I was in between these two numbers. So I have my Part B premium. I also am going to get charged the Part B IRMA, and then I'm going to be charged Part D income related amount. So instead of paying $185, I'm paying $405.30. So that question I get is, well, I work, my spouse doesn't work. Why are we both paying the same premium? Well, that's because we file our taxes jointly. If we filed married with separate returns, chances are one of us then would be paying $670 and the other one would be paying $185. So it almost comes out to the same amounts. A question came in is, do you have to select Medicare Part A and Part B, or do you select one? That is given to you by the government. So you just enroll in what the government gives you, the A and the B. You will need both of them. The other question I get is, okay, let's say the 300,000 again over here, but now we're not working and our income's more like 100,000. There's a form you can fill out. It's called an income related monthly adjustment event form. It's going to say, well, yeah, I made some money, but now I stopped working. Now I'm not going to make as much money. Please reduce my Part B premium. So you'll be able to request that through your local Social Security office, and then you can reduce it to whatever level you think your new income was going to be. Um, Robert, just let me know what BBS is that you're referring to, and I'll answer your question. So, big question I get is, when do I do this? Well, if you're already collecting, so if you're under age 65 and already collecting Social Security based on you or maybe your surviving spouse, you will automatically be enrolled in Medicare Part A and Medicare Part B. And its coverage is effective the month you turn 65, unless your birthday happens to be the first of the month, then it's the first of the month prior to you turning age 65. That happens automatically. If you're still working and covered under employer plan, or you're not working, you're covered under your spouse's employer plan, you could fill out the back of this form and say, I don't need the Part B because I have creditable health insurance through my employer's plan. But make sure you're okay with that. If the employer has less than 20 employees, typically they require that Medicare Part A and Medicare Part B be primary, and then your health insurance would be secondary. If I'm turning 65 and need health insurance, then the 3 months before the month I turn 65, up to 3 months following the month I turn 65, I can apply for Medicare Part A and Medicare Part B. There's no decisions to be made when you do that. You're just applying for what the government gives you, Medicare A and B. If you're over age 65 and you're still working, or your spouse is still working, you're covered under their employer plans. Then the rule is within 8 months of leaving employment or losing coverage, whichever is earlier, you can apply for the Medicare Part B without any penalty. Your employer will have to fill out paperwork that says you've had creditable health insurance from age 65 to present, and that will allow you to apply without any penalty. Please recognize that this rule does not apply to domestic partners. They must be spouses. Couple questions here. Well, I'm turning 65. I'm covered under my employer's plan. Well, Part A is for free. Why shouldn't I just enroll in Part A? Well, the Part A is, a lot of people will enroll in Part A, and it is good to do that unless you're contributing to a health savings account. You cannot have Medicare Part A and also contribute to a health savings account. It would be there's some tax consequences of that. So just be careful with that. The other thing is, again, I mentioned earlier, if you're turning 65 and you work for a small employer that has less than 20 employees, they may require you to have Medicare Part A and Medicare Part B. So read your mail, look what's coming in to find out if you have to make any changes about that. Here, I want to talk about this just for another minute. So let's say I'm 70, I'm still working, and my employer is handing out some packages that's saying, listen, Natalie, if you retire, if you take this package, we'll provide you with health insurance until you hit for 12 months. We'll provide health insurance for 12 months. We have to be really, really careful of this because I'm no longer working. So although they're paying for my health insurance for 12 months, I must apply for my Part B within 8 months of leaving employment or losing coverage, whichever happens first. So although, let's say my last day of work is December 31st, they're providing me health insurance for 12 months, I must still apply for Medicare Part B to be effective for August 1st to make sure I don't have any penalties. You want to be very, very careful because the last thing you want to do is have a penalty from the government because you'd be responsible for that penalty for the rest of your life. So one of the questions is, if I'm on a Blue Cross Blue Shield plan, I'm not sure if this is a Medicare plan or just an individual plan or a group plan. Can that be used to pay the extra 20%? So yes, so if you have an individual plan or if you have a group plan, depending on the size, how many employees there are, if there's under 20 employees, so if you're on a work plan, thank you. If you're on a work plan, there's probably no reason for you to sign up for Part B. Just keep your work plan unless, again, small employer under 20 employees, and they're requiring you to sign up for Part A and Part B. So If you're not contributing to the health savings account, yes, apply for the Part A. If you have more than 20 employees, look at the numbers. How expensive is it to stay on your employer plan, or how expensive is it to enroll in a Medicare plan, and make some decisions that way. This presentation, if you send me an email, you and ask me, I could send you either the slides or the exact work, this exact presentation if you're interested in it. You could just send me an email. So again, there's penalties for enrolling late. That's why you want to make sure you're doing it correctly. In doing that, there's financial penalties. That penalty is 10% for each 12-month period that you could have had Part B and didn't sign up for it. So this is really for that person who has a package, and through that package, they have insurance for 12 months, but they don't apply within the 8 months. So that's a big deal. You want to make sure you're careful with that. And then there's the time period penalty, is that I find out in June, I should have enrolled, but I didn't. Well, I cannot enroll again until the what they call the general enrollment period that goes January 1st through March 31st. And whatever day, let's say I enroll on January 1st, my coverage would then start February 1st. So not only is there a financial penalty, but there's also a time frame, a time period penalty. If I'm collecting Social Security, the Part B premium will come out of my Social Security check every month. They want to get paid before they pay you. If I'm not collecting Social Security yet because I'm waiting to my full retirement age, or I'm waiting to age 70, then what'll happen is that they will send you a bill quarterly. So 185, the standard premium times 3, they're going to send you that bill quarterly, or at least the first time they'll send it to you quarterly. Then if you're a high income earner, they'll send you a second bill saying you're a high income earner, you owe this extra money. Once you receive and pay for your first bill, you can then go on to medicare.gov and actually pay your premium monthly there, or set up automatic checking account withdrawals that you can use to pay that. So once you have Medicare Part A and Medicare Part B, that first option I showed you, and then the second option, this is the first option. You can enroll in what they call a Medigap plan or a Medicare supplement plan. They're designed to cover some to all of your co-payments, co-insurance, deductibles that Medicare has. They are sold by private insurance companies. They are not sold by the government. The nice thing is it really allows you to see any Medicare provider anywhere in the United States for a Medicare service. And to enroll in this plan, you must have Medicare Part A and Medicare Part B. And prescriptions are not part of this plan, but can be purchased separately, and does not need to be purchased from the same insurance company as this insurance company. You cannot have a Medigap plan and also a Medicare Advantage plan. So when you look at the supplements, there's lots of options. They go from the letter A to the letter N. But again, these programs are federally regulated by the Center for Medicare Services, CMS. So every Plan G is a Plan G, every Plan N is a Plan N. The difference from one insurance company to another is the price and some of the value-added discounts and services. Again, here's A through N. This is pretty complicated chart. Try to simplify it a little bit. Our parents were probably on a Plan F because that was the most comprehensive plan for those people. If you were born after, if you turned 65 after January 1st of 2020, you're not eligible for that plan. So the most comprehensive plan is the Plan G. This is a great plan for someone who has a lot of medical expenses and has a lot of doctor visits. It's also the most expensive plan. So with this plan, you see everything's covered 100%, except for that Part B deductible. This year, that Part B deductible is $257. So it's a very comprehensive, very rich plan. Most people do not need that much insurance, so they'll step down to a Plan N. With a Plan N, in addition to that deductible, you're also responsible for a copay for each doctor visit of up to $20, and urgent care and emergency room copays of $50. If your doctor does not accept assignment of Medicare, then they can charge you an extra 15% fee that you're responsible for. Many states rule that doctors cannot charge it, so it's different by state. And I sell in almost all the states. I have yet to hear a client tell me that they've been charged this excess charge, but it is in here, so they could charge it in the future. So that's one step down is there. A lot of people are on high deductible plans now and they like the idea of that plan. There's also a high deductible plan G. With the high deductible G, what happens is you're paying a much smaller premium, and then you are responsible for all of these. This says 100% here. You'd be responsible for all the deductibles and all the co-insurance up to $2,870. So if you go to have a good year and you go to the doctor 3 times, you have very little in copays. You have a bad year, it caps your out of pocket at the $2,800, a little over $2,800. So it's really a personal choice, and recognize the cost for these plans in every state is a little different. So you do want to look and say, okay, which plan makes the most sense for me from a cost perspective, and how does that, what will it look like? So while it's important to understand what's covered, it's also important to understand what's not covered. So custodial or personal care, long-term care, is not covered by Medicare. So let's talk about that. So I have a stroke. I go to the hospital. I'm in the hospital for 4 days. Then I need to go into a skilled nursing facility for physical, speech, occupational therapy. As long as I continue to show signs of improvement, Medicare will pay up to 100 days of skilled care. As soon as I stop showing signs of improvement and I'm just pretty steady, well, it's no longer skilled, it's only personal care, and Medicare will stop paying. So that means your insurance company will stop paying. So just want to make sure you recognize that Medicare does not cover for long-term care. If that's something you're interested in, you should look at it through another insurance product. Medicare won't pay for concierge medicine. They will not pay for coverage for providers who opt out of Medicare. Cosmetic surgery, massage therapy, that sounds pretty, common not to be covered. So care while traveling outside of the United States, many plans will pay for some coverage outside of the United States. Take a look at it, see if it's enough, or if you need some additional insurance. They do have some travel medical plans. While Medicare does not cover the vision, the testing of your eyesight, the refractions exam, they will pay for retina, glaucoma, and cataract issues. And Medicare does not cover any dental or hearing, but you can purchase additional individual plans, or maybe some riders, or maybe there's some value added benefits for dental and hearing. Let's see what I have here from a question. So if I'm already collecting Social Security and I'm turning 65 in January, in October, I'll probably get my Medicare card in the mail. It comes in like a 5x7, not dark brown, but like a manila, but a little darker envelope. That is the government's envelope. So really look out for that. And that'll come in October. And then you can decide, what you want to do for a secondary insurance, because your Part B will start for January 1st, and the premium will come out of that January, that'll come out of your January check. So once you have a supplement plan, you must then also enroll in a Part D plan. Actually, the government only requires that you have A and B and you enroll in a drug plan. They don't require anything else. But people enroll in secondary insurance just so that they don't have, they have a cap to at least what their out-of-pocket exposure is. So with a Part D plan, they're designed to lower your prescription drug costs. They are sold by private insurance company. You must live in the plan service area. So if you move out of state, you must change your plan. Most of the plans have preferred and standard pharmacies. So if you really like that little mom and pop pharmacy at the end of your street, you want to see which plan would work best for them versus some of the bigger pharmacies. Drug coverage may be included in Medicare Advantage plans. And again, if you do not purchase a Part D plan when you're first eligible, there could be a penalty for each month you are late in enrolling. So if I'm eligible for Part D, but I say, I don't believe in prescriptions, I don't like taking them, I just take supplements, I still encourage you to buy a plan because you don't know when you might need a prescription and you want to make sure you have it. Otherwise, there's that time period penalty and also the financial penalty. So enroll yourself in an inexpensive plan for that just in case. So again, I'm getting a lot of requests to send the presentation. I'm not going to be able to see it on the screen when I close the screen. Can you send me, I'm sending you my email. Can you send me an email? Just click on that and send me an email and I'll be sure to send it over to you. So one insurance company might have 3 different plans, and each plan is going to have its own formulary, which is really a listing of all the prescriptions that'll be covered under their plan. The tier ones are the preferred generics. Those are the ones that everybody's taking, the generic for Lipitor, the generic for Crestor. These things are all covered under there, and many times they're at a 0 copayment. Tier 2 would be your non-preferred generics. Tier 3 is brand name prescriptions preferred. Tier 4 is non-preferred, and Tier 5 is specialty. So again, I was saying that buy a plan just in case because there are drugs. I had one this week. It was $89,000 a month for this prescription. So there are some expensive prescriptions, and when you need it, you're going to want to be able to have access to it. So I really encourage you to look at a drug plan. With prescription drug plans, new for this past year is that there is no donut hole. So what that means is that the most, besides your premium, the most you'll pay in copays is $2,000 for your copay. So that person who's taking that $89,000 prescription, they're going to pay their $2,000 at the beginning of the year, and they pay 0 for all of their prescriptions for the rest of the calendar year. So just to understand that, to recognize that. Drug plans change every year, so you want to make sure that you look at your prescriptions every year and make sure you're in the right plan every year. Howard, I will answer your question, but let me get to that page. The other thing with the Inflation Reduction Act, about that $2,000, they also have something called smoothing. What that means is for someone who has, let's say in January, you get your first prescription, all of your prescriptions, and it's $2,000, you could spread that cost over the remaining 11 months. So instead of paying $2,000 up front, I have to do this quickly on my calculator. You would just get a bill for $181.82 every month. So it doesn't hurt you so much at one period of time. In 2026, some of the changes with the Inflation Reduction Act is they're expecting to discount the cost of 10 very expensive prescriptions. I know Eliquis and Xarelto are on that list. So let's see. We don't know yet what it's going to look like, but we'll see on October 1st how those prescriptions will be treated for next year. So we talked about supplement plans. We talked about prescription drug plans. Now we're going to talk about that option 2. The option 2 is the Medicare Advantage plans. With these Medicare Advantage plans, what they do is they combine your A for hospital, B for doctors, D for drugs into one plan called a Medicare Advantage or a Part C plan. When they first came out, they were all HMO plans, meaning you can only see providers that are in that plan's network. People were complaining. They said they wanted more choice, and they started coming out with more PPO plans, where it allows you, they do have a network of doctors. So if you see their network, their doctors in the network, your copays are lower, but it allows you to go outside of the network. Either you prepay and get reimbursed, or sometimes the doctor's office will do the billing for you to get that all set up. So those are how that is set up. And those are actually starting to go away again because they're very expensive for the insurance companies. So you might see less or very few PPO plans and more of the HMO plans, really focused on having a network of doctors. There's also what they call these special needs plans. These special needs plans, some of them are based on low income subsidy. So if they're at or below the federal poverty level, they'll get some subsidies, and there's some special plans that are designed for them. Some of them are institutional skilled nursing facilities, special needs plans. So if you're in a skilled nursing facility, you can switch over to that, a special plan for nursing home only. It's a nursing home only special needs plan. And there's also some plans for chronic condition. So if you're a diabetic, if you have specific heart condition, there are plans that are available to you, and they're called these special needs plans. They're designed to help you with the expenses involved with having that chronic condition. With Medicare Advantage plans, there's as many as 46 plans in one specific service area. So it's very difficult to do the research and take a look and see what your options are. But this is my recommendation if you're looking to look at plans. The first thing you want to do is put in your prescriptions, take a look at how they're covered under each of the plans, look at the pharmacies. So at least you could see, okay, from this plan to this plan, well, two of my prescriptions aren't covered under this plan, so that's not even an option. So I go back to this plan. Then I say, okay, for that plan, are my doctors in the network? You want to make sure all of your doctors and hospitals and mammogram centers and all the different things that you frequent, that they're in network for you on these plans. All things being equal, then take a look at what are the extras. Some of them offer preventative dental. Some of them offer comprehensive dental. Some of them offer what they call an over-the-counter benefit. So then you can take a look at what the extra things are and see what's important to you or not important to you. Again, looking at supplement versus a Medicare Advantage plan, when you look at the cost, the supplement definitely has a higher premium, but the out-of-pocket is a lot lower. Where a Medicare Advantage has low to no premium with higher out-of-pocket. Those out-of-pockets, depending on the state, will go anywhere from $5,000 to $10,000 for the year for in-network services. Providers with a supplement, you don't have to say, do you accept XYZ insurance company? You say, do you accept Medicare? If they accept Medicare, you can go to any of those providers. With a Medicare Advantage plan, there is a network of providers. And again, the ones that do offer out-of-network services, you have to talk to the provider to make sure they're willing to see you out of network. As far as coverage, a supplement plan is only medical. You must purchase a separate standalone drug plan. And if you're looking for dental or other coverages, you have to purchase those separately. With an Advantage plan, it's typically one card. That one card is for hospitals, doctors, and your prescriptions, as well as some of the extra things. The other thing with Medicare Advantage plans, many people don't realize is on straight Medicare, once you're entitled or you're enrolled in Medicare Part B, you get a one-time welcome to Medicare full physical. After that, they don't cover well visits. They only cover sick visits. So if I have a problem with my cholesterol, yes, they'll pay to have my blood tested for cholesterol. But if I don't have any issues, they will not pay for that test. But with a Medicare Advantage plan, they do offer an annual physical, and then they have some of the extras like the dental, vision, and hearing. So when you're looking at plans, you want to look at the benefits. You want to understand what's covered, what's not covered. You want to look at your doctors and your hospital. Is your provider in the network? Are you willing to go to any hospital? Do you need to see a referral, need a referral to see a specialist? When you're looking at the cost is so much more than premium. It's the premium, it's the co-insurance, co-payments, deductibles. What's the maximum that you'd be responsible for out of your own pocket? You want to look at the prescriptions. Again, I tell everyone, look at your prescriptions first before you do anything else. What will your drugs cost under the formulary? Have they changed from one year to another? Is there a difference from one pharmacy to another? Traveling, are you out of state part of the year? So we mentioned the HMO plans with Medicare Advantage. So even though I might have a home in Connecticut and a home in Florida, a lot of these networks, even the HMO networks, they're national. So you can see a doctor in Florida and a doctor in Connecticut. Do you travel outside of the United States? Some plans have better international coverage than other. You want to take a look at that. All the plans come November will have a grade. It's a star rating. This star rating is determined by member surveys. The plans themselves, the providers, it's an overall performance score, 5 being the highest. There was created to help you compare plans based on quality and performance, and these numbers will change each year. So if you look at a plan today, come November, that star rating can change for next year. So it's just a report card. Can I change my plan? So you're making a really important decision. So for your entire life, you're on your parents' plan, then you're on your first employer's plan. Now, for the first time in your life, you're making a decision about what plan to enroll in. Recognizing that there is an annual enrollment period that goes from October 15th through December 7th of every year. You could keep the same plan. If you don't do anything, it just automatically renews as long as you're paying your premium. But again, always look at the cost of your prescription drugs and their tiers. You want to compare Medicare plans. You want to make sure you're looking at it every year to make sure you're choosing the plan that's right for you. Switching from a Medicare Advantage plan to a Medicare supplement, the rules vary by state, so it may require you to answer medical questions, and then the plan can charge you a higher premium or say, sorry, we're not going to take you. So it's important to know what state you're in or what state you're retiring to know what the state rules are, as well as your where you are currently, to make sure that works and comes into play. The same question is if I'm on a plan G and I want to switch to a plan N, or plan N and want to switch to a plan G. If you're one of those states that have medical questions, they may require you to ask medical questions. It might not be just, okay, here, sign this form and we can change that for you. So it's really important to know what those state rules are. If I'm on a Medicare Advantage plan, then the first 3 months of the year, I'm also given another opportunity to switch from one Medicare Advantage to another, or to cancel my Medicare Advantage plan to go to original Medicare with prescription drug. But again, if you do that and want to enroll in a supplement, you have to pass that medical underwriting. So just know the rules. Moving from a different service area. So if I live in Connecticut and I'm moving to South Carolina, I must change my plan within 60 days. So that'll be important to note the drug plan and the Medicare Advantage plan. Many of the supplement plans you can take with you wherever you're going. And if there's a 5-star rating in my service area, I can change that 5-star plan at any time. So that's important to note also. Let me see, I'll answer that question in a minute. So resources, Medicare is an amazing resource. I call with them. Here's the website, here's the phone number. Social Security, based on your zip code, the phone number could be different for local Social Security. Barnum, we're a resource. We do this every day. I talk to people every day. If you call this phone number, I have a team of people that are educated and equipped to answer your questions. I mean, the biggest questions we get is, when do I do this? Or how do I do this? Call us. It doesn't, cost you anything to call us and ask the question. So feel free to give us a call, and we're happy to work through that. Here's my contact information, my phone number, my email. You can go on Calendly and you can actually schedule an appointment with me. So feel free to do that. And let me see if I can get through some of these other questions. And you know what? I'm also going to open up, if someone wants to raise their hand, I'm happy to let them talk and ask questions also. So Robert, if I understand correctly, you're on a work plan. With Blue Cross, and the doctor's in an HMO network. I don't know if I understand exactly what you're asking me. If your provider's in the HMO network, again, you have to look, you just don't want to look at HMO network and say, okay, yes, this is good. You want to say, okay, over the last 2 or 3 years, a lot of Medicare Advantage plans have been having disputes with provider groups. So while they're in network today, there's no guarantee they're going to be in network tomorrow. So if a provider is important to you and you're very particular about your providers, you're probably more of a person who wants a supplement plan than an Advantage plan, because the Advantage plan, while they have a network, that network can change in the middle of the year. So you have to be really careful with that. The star ratings are only for drug plans and Medicare Advantage plans. They are not for supplement plans. So we talked about a couple different enrollment periods. So when I'm newly eligible for Medicare, that's my initial enrollment period that I get to enroll in whatever plans I want. Then every year from October 15th through December 7th, I decide, do I want to stay in that plan for the following year or do I want to make changes to that plan? That's the annual enrollment period. Then there's one after that that's called a Medicare Advantage open enrollment period where, I didn't really read the notice that they sent me about my plan, and I found out that one of my important prescriptions is not in the drug formulary. So I want to be able to change my plan. So it gives you, oops, I made a mistake. I want to change my plan. That's what that third enrollment period is. That Medicare Advantage open enrollment period is really to change during that period of time. Let's see. I think those were all the questions. I have a hand raised. Jimmy, did you want to ask a question? Feel free to unmute yourself.
Hey Natalie, how you doing?
Hi.
Yeah, so this is this is very complicated. This is our first time dealing with Medicare. So I was the one that said both my wife and I own Social Security, uh,
Okay.
and so I turned 65 in January. I worked for IBM for 38 years. We are currently on my wife's company's benefits, which is the state of Georgia, because she worked for a college here, and it's very reasonable. But I'm confused because I think I have options to do some of these other supplements.
You do. So yours is very, very different, Jimmy, than most other people because you're going to have access. The state of Georgia has a retiree medical plan. The federal government has a retiree medical plan. So you don't need to, you still are going to need to have A and B, but you're not going to need to enroll in a individual retail plan. Your plan would be either, so right now you're on the state of Georgia as the spouse of an employee.
Yes.
You could stay in that plan and not enroll in Part B. If you're collecting Social Security, you're going to be one of those people that's going to return the form saying, I do not want my Part B because I'm on my spouse's employer plan. So this way you don't have to pay for the Part B. So as soon as you get the form, you want to return it and send it back to them. So through your wife, you're eligible to stay in that plan. When she retires, then you could decide, okay, are you going to go on the state
She's
of,
already retired, and we on her retirement plan.
oh, you are on her retirement plan.
Yep, she
They
retired. I retired 2 years ago. She retired earlier this year. So
God bless.
we're
That's beautiful. So both of you will need to have A and B. So that's going to be a requirement for the retiree medical plan. So you're already collecting Social Security. That'll happen automatically. And then you're just going to continue on her plan.
okay. The other problem I have is that working for IBM, they do have what they call a health account, which has a lump sum of money in there. And I can only get that money if I go back on an IBM plan, but I don't know if it's going to be lucrative as the state of Georgia. So that's another issue I have.
Yeah.
We're talking about, 30 plus $1,000.
Yeah, no, I know. I deal with a lot of people from IBM too. You're right. You have to really look at it and see because IBM only offers a Medicare Advantage plan. I don't know what the state of Georgia offers. So you really have to
I
really
got to look
think
at
about
both.
it and make some decisions. Yes.
Okay.
If you need a little help, if you get me before the open enrollment period, I don't mind talking to you and helping you understand the differences. But after October, I'm not going to be able to help
Okay.
you
So what
with
I'm going
that
to do,
one.
Natalie, I'm going to reach out to you individually and before October and see if we can chat a little bit more. Thank you.
Sure. Thank you. And then another question, so the question is, okay, if for the Part B premium, it's based on my tax return. So let's say I'm below the number, so I'm below the $212,000. But now next year, I have to start collecting my required minimum distribution. So my income is going to go up because I have to do that. Every January 1st, the government automatically looks at my tax return from 2 years prior. So in 2026, if I take my first RMD, I'm not going to be impacted on that for my Part B premium until January 1st of 2028. Because in 28, they're going to look at my 26 return. So it's that 2 year look back. So it's and it happens automatically. So if your income goes up or your income goes down, January 1st of that year, they look at 2 years prior the tax return to determine what your Part B premium will be. Howard, let me know if I didn't answer that question for you. Think we're okay? Perfect. Well, listen, everyone, I know we took more than the 25 minutes, but with the questions, I wanted to make sure I was able to answer everyone's question. Again, utilize us as a resource that we are. If you have any questions or you need any help, this is my contact information. I have another question. Okay. This is a question from one of the people on the call. So he's currently enrolled in a Medicare Advantage plan, one of the Part C plans. And, again, the Medicare Advantage plan have networks, so the doctors get to decide, do I want to be part of this network or not part of this network? Many of them choose not to be part of the network because Medicare reimbursements are low. Medicare Advantage reimbursements are even lower. So the doctor's not getting paid a lot of money on a lot of these Medicare Advantage plans. So the question is, or they're stating that they're concerned that doctors and hospitals will be reluctant to provide medical care if most of their charges aren't paid. It's becoming a bigger issue. This year, the last year and a half, I've seen a lot of large insurance companies trying to negotiate with provider groups, and usually they came to some type of terms, if not by the deadline, soon afterwards. Recently, we've had a few where they said, no, we're going to play hardball. We're not going to negotiate our contract. And they're losing specific doctor groups in that network. They lose that doctor group and you're on that plan, you're stuck. There's not a lot you can do until the next or that current year's annual enrollment period for the following year. So yes, while Medicare Advantage plans are great for a lot of things, you have to be willing to be able to change your doctor if something comes up like one of these provider negotiations. Anything else from anybody? I'm looking back. I think I've answered. I love an interactive group, so thank you. It's a lot more exciting than me talking to myself. So thank you for your questions. I think that's it. Listen, everyone, have a wonderful Monday. Thank you for being here with me. And if I can help with anything, please let me know. Take care. Bye.